Respoc, fast, cost-effective, user-friendly point-of-care instrument for detection of respiratory pathogens, including Streptococcus pneumonia. Every year in the USA, pneumococcal hospitalizations are estimated at 445,000 cases. The number of acute visits slightly increases up to 774,000, and the total number of cases identified were nearly 4 million. Extrapolation to Europe, 300 million people versus 500 million, shows an aggregate hospitalization number of 741,000 and 1,290,000 acute cases in Europe. The direct and indirect costs of pertussis and pneumonia pose a significant economic burden in terms of healthcare and social costs. Molecular techniques such as PCR, polymerase chain reaction, are becoming increasingly used for the detection of respiratory pathogens due to their high accuracy and relatively fast turnaround time. However, implementation of rapid molecular diagnostics remains limited to large centralized laboratories which can afford the requirements of dedicated PCR laboratory space, specialized personnel, and costly equipment and consumables. There is a need for a fast, cost-effective, user-friendly molecular diagnostic point-of-care instrument for near-patient use at small to medium-sized hospitals and decentralized clinical laboratories. The Respoc platform will be a novel solution designed to detect bacterial and viral respiratory pathogens in less than 1 hour. The solution will enable simple collection and analysis in a time frame between 30 to 45 minutes and enable up to 6 samples to be analyzed simultaneously. Respoc will develop a molecular analysis point-of-care diagnostic instrument which overcomes the limitations of the state-of-the-art. The device will integrate and automatically perform detection of the target pathogens based on the following main steps. 1. Sample introduction, followed by fast DNA extraction using heat treatment. 2. Selective DNA amplification by means of loop-mediated nucleic acid amplification technology. 3. Detection by optical fluorescence. This instrument is robust, cost-effective, and easy to use by healthcare providers that have no easy access to centralized laboratory services. Allows straightforward interpretation of measurements, decreasing the time to result. Minimal invasive sample collection, preferred for children, infants, and newborns. Specific, accurate, and fast, enabling early diagnosis and treatment, thus reducing costs. Benefits healthcare providers via more cost-effective use of lab and clinical resources. Allows a rapid and improved patient management, saving visits to the laboratory for sample extraction and return for collection of diagnostic results. Improved control and surveillance of target pathogens and early detection and response to respiratory infection outbreaks, interrupting pathogen transmission within the community as well as nosocomial transmission. Reduced spread of antimicrobial resistance resulting from prescription of antibiotics following misdiagnosis.